of National uh, Body of Allied Health Sciences, Dr. Yagna Shukla, the country president, Dr. Pankaj, the country secretary, Dr. Joseph, my friend Jyotika Bijlani, she already declared it in her speech, Dr. Ganpati, my own academic in charge, Dr. Sandeep Sardesai, Madam Samanta, and the organizing secretary, Dr. Vivek Vajratkar. I am really humbled by the gesture shown by the group of occupational therapists in understanding the work that is going on at Goa Medical College. To be very frank and sincere, I will tell you, I joined Department of Orthopedics somewhere in 1992, and that is a time that we had a section of occupational therapy, one section where we had only 2 occupational therapists. I still remember them. One was Mr. M.K. Ward, the second was Madam Judy Kantim. I don't know whether she is here in the crowd. They used to work day in, day out and treat the patients. It was in 2013 that we thought that occupational therapy has an important role in the rehab of patients' illness. And in this year, we started the College of Occupational Therapy with 10 seats, and today it has grown to 22 seats. We had no postgraduate courses at that time, but in year 2021, we started 2 PG seats in the occupational therapy, and later when I became the Dean Faculty of Medicine, Goa University, we added another 5. So now we have 5 postgraduate seats in occupational therapy. I'm going to add more, and especially when Pankaj ji said that morning was a great talk on rehab after the head, face, neck surgeries of cancer. It is really a matter of concern, because as a surgeon, I am a surgeon. For us, our best friend is our knife. Then we don't know where we run it. And at the end of the surgery, you live with so many deformities, so many deficits, and so many disfigurements. So here, the occupational therapy on oncology, we want to start PG in occupational therapy in oncology, in Goa Medical College, in the next academic year. And these are all India seats, anybody who wishes, because there is a lot of oncology work goes on. I myself do a lot of, megaprosthesis, I do excisions of the tumors. What is important here is that occupational therapists, I love them because they give life to the patient. They really give life to the patient. It is not easy, because many a times after doing a good surgery, a surgeon feels he is on the top of the world and he has no time to talk to the patient. And many a times we have seen iatrogenic equinus deformity, we have seen iatrogenic contractures of the joint, and all this has now disappeared from the Goa Medical College patient care. So they have added one great layer of treatment for the patients. I also wish to create an artificial intelligence, a special skill lab for students of occupational therapy in Goa Medical College. And it is already on cards. It will also be utilized by medical students, but we already got a sanction of 20 crores to have what is known as high fidelity skill lab. And here our students would practice day to day, as this is with your principal here, that is using research for policy and clinical treatment. In fact, we do research to see that the life of the patient improves and that research helps the person or helps the patient. And this research must continue. And in the same stride, we are also putting a research unit for occupational therapy and physiotherapy in Goa Medical College very, very soon. I have my physiotherapy in charge here. She's just giving me a smile, but that will happen very soon. It is very important that we understand that this science of occupational therapy is taken to a different level for altogether benefit of the patient. And in doing so, whatever help is required from my side, Dr. Vivek, I promise you, in presence of all your occupational therapists, it will be extended to you. This should be your biggest award today. Whether you need a best kind of a lab or you need a rehab center, it will be done. And our government, our Honorable Health Minister, today we don't have him with us physically, but he has sent great wishes to all of you. He's a man who has changed the healthcare in state of Goa. And his healthcare policies are called as Goa model. Now here, you will go, if you get a time, you go and please see our PNRC, that is Pediatric Neuro Rehab. And as I was discussing with Jatika Madam, I said it is so difficult to treat people with neurodevelopmental problems in children. But she told me it is literally easy if you like the subject. I agree with her because children sometimes are so irritable, but if you like them, nothing is difficult. And we have one of the best neuro rehab center in Goa, and it is sponsored by government of Goa. Such things are not seen anywhere else. If you see my medical college, it looks something like better than a private hospital or a corporate hospital. You should visit my super specialty block where government is pouring in money and all the treatment is given free of charge. So as on this day, I promise you the next OTICON, you will see the occupational therapy department to a different level and you will enjoy to see it. With this, I thank you for giving me this opportunity. Thank you.
Thank you, sir. Next, I would like to invite Samantha Shawn, President, World Federation of Occupational Therapy, to come up and address all of us. We warmly welcome you.
Honourable Member of Parliament, Madam Chairperson Rankap, President of All India Occupational Therapists, the Dean of ACOT, the Dean of Goa Medical College, the Scientific Chairperson, and all distinguished guests on stage and also down there. It is always exciting for me to see so many occupational therapists and occupational therapy students together in one room. So thank you for inviting me to be here. It's exciting to be part of the 62nd Annual National Conference of the All India Occupational Therapists Association, OTICON 2025. And it's wonderful to be here in the beautiful city of Panjim in Goa, my first time in Goa. The World Federation of Occupational Therapists, WFOT, is a federation of 111 regional and national occupational therapy associations. And as President, I bring you greetings from the Board of Directors and well wishes from colleagues around the world. The All India Occupational Therapists Association was one of WFOT's 10 founding members back in 1952. Thank you. And you continue to be a very valued member today. Thank you to the association and its leaders over many years for their vision and hard work. Thank you to the Congress organisers, the Goa branch of AOTA. Your efforts are very much appreciated. And thank you for such an excellent venue at Goa Medical College. We have ahead of us a vibrant scientific programme, and the social programme looks very exciting too. Occupational therapists are creative problem solvers. We learn from what is available and have the confidence and ability to adapt and create new evidence-informed and evidence-based practice and research. The Congress theme, Translating Research into Policy and Clinical Practice in Occupational Therapy, challenges us all to think about our practice, education and research. As occupational therapists, we should be generating our own research, as well as learning to use a wide range of research in our practice and education. I'm looking forward to hearing from a wide range of speakers, and thank you for the speakers today. As individuals, we all bring our own unique experiences, knowledge and skills to the profession. How we encourage and share this knowledge is important. We must be aware of and learn from our cultural differences. We must appreciate and learn from diverse perspectives and allow and support everyone in the profession to develop in their own way. Everyone has a valued and respected voice and opinion. And this is so important at conference. The future depends on what we do today. People change the world. What you teach and learn today will shape the future of the profession and occupational therapists of the future, influencing practice, education and research. However, conference is not just about learning, it's also about friendships and connections. Or if I want to be more academic, it's networking in action. So please enjoy conference. Do come and talk to me as well. I really want to learn as much as I can about occupational therapy in India. So enjoy conference and the wide range of speakers. Connect with each other. Share and develop best practices together. Learn together. Grow together. Because together we are stronger with a clear vision. I wish you all a prosperous and wonderful conference. Thank you.
What are inspiring, motivational words by Samantha Shawn. It truly indicates women empowerment and women supporting another woman. Like, I'm so glad to share the stage with women, successful women like Dr. Jyotika, then Samantha Shawn, and now we have with us Dr. Yagna Umesh Shukla, Chairperson, National Commission of Allied and Healthcare Professions, to say few words. Big round of applause for Dr. Yagna Shukla ma'am.
Namaste and very good evening. Honorable Shri Sadanand Tanavade sir, respected Dr. Samantha Shawn madam, respected Dr. S.M. Bandekar sir, respected Dr. Pankaj Bajpai sir, respected Dr. Jyotika Bidlani madam, Dr. Sunny sir, that is easy. Dr. Ganesh sir, Dr. Vivek sir, Dr. Sandeep sir, stall ones on the dais, off the dais, of occupational therapy profession. I would especially like to mention Dr. Senapati madam because she was a member of interim commission of